Run your fingers through your hair for 3 seconds and just listen to the sound. If you hear more crackle than you used to, if the brush fills faster, if the light on your crown looks a little too bright, stay with me. In the next minutes, I'll give you a calm, science-based plan that stops excess shedding, supports your follicles, and helps your hair look thicker again. No wild claims. Real steps you can start tonight. And at the end, I'm going to ask you for one small promise that changes the next 90 days. When people say reverse hair loss, they usually mean 2 things without noticing. First, stop the fall from being higher than normal. Second, bring back thickness. New baby hairs, better texture, less visible scalp. Those 2 wins run on different clocks. Calming shedding can happen in weeks if you fix the cause. Thickening is slower because hair grows in cycles. The early wins are quiet, fewer strands on the pillow, less widening in the part line, that tiny halo of short hairs catching the light at the hairline. Most consistent people notice real change between week 4 and week 12, and more obvious thickening between month 3 and month 6. Hair moves on plant time, not phone time. Patience isn't a side note, it's step 1 of treatment. Before we spend $1, we figure out what we're treating. There's genetic pattern loss, the classic crown thinning in men and widening part in women, where DHT slowly miniaturizes follicles. There's stress-triggered shedding after illness, surgery, fever, childbirth, crash dieting, or a heavy life event. Too many hairs jump into the resting phase at once, then fall together 2 or 3 months later. There's alopecia areata, round patches from an autoimmune hit that can come and go. There's traction from tight ponytails, braids, extensions, and rough chemical treatments. Different story, different tools. If your shedding was sudden and heavy, if you see neat round patches, if your scalp is burning, itchy, scaly, or painful, or if you're noticing pus or crusts, don't wait. See a dermatologist. A quick exam can save you months of guessing. Quiet saboteurs hide in a simple blood panel. Ask for ferritin to check iron stores, vitamin D, thyroid function, and for many women with acne, cycle changes, or chin hair, a hormone workup to rule out PCOS. When ferritin is low, follicles get stingy with growth. When vitamin D is low, the whole hair cycle feels sluggish. When thyroid is off, hair follows. Fixing the root numbers turns frustration into momentum. If labs are normal, we move on with confidence. If not, correction comes first. Your scalp is the soil, your hair is the plant. Soil first. Keep it clean, calm, and gently stimulated. Choose a gentle shampoo you can use regularly. Avoid harsh detergents that strip and inflame. If you deal with flakes or oil, a shampoo with zinc pyrithione or ketoconazole once or twice a week can help the environment without being a daily hammer. Add 3 minutes of slow, steady scalp massage with your fingertips every day. Not a scratchy rub, just patient circles. It improves microcirculation and delivers nutrients to the bulb. Be kind to wet hair. Pat, don't yank. Wide tooth comb, not a fight with a brush. Bring down the heat tools, space out bleaching and relaxers. If you must, give hair a recovery month to let the cuticle heal. Inside your body, follicles are tiny factories. Factories need supplies. Spread protein through the day. Eggs or Greek yogurt at breakfast, legumes or fish or lean meat at lunch and dinner. Add omega-3s from salmon, sardines, walnuts, or flax. Load a plate with dark leafy greens, beans, and colorful vegetables for iron, folate, and antioxidants that calm microinflammation. Micronutrients matter. Correct iron if low, vitamin D if low, B12 if low, and be sensible with zinc and selenium. Biotin helps if you're deficient. Otherwise, it's not the hero of this story. Hydrate. Cut the sugar spikes and ultra-processed foods that tug hormones and inflammation in the wrong direction. This isn't a diet pitch. It's a supply chain for your follicles. Stress and sleep are the invisible hands on the hair cycle. Elevated cortisol quietly pushes more hairs into the resting phase. The fallout shows up weeks later, and we blame the wrong week. If life has been loud, your plan needs quiet moments you can actually keep. 7 to 8 hours of sleep most nights, a 10-minute walk outside after meals, 3 minutes of slow breathing when tension hits your shoulders. These aren't nice to have. For reactive shedding, they're medicine. Now the pillars, the tools with the most evidence. Topical minoxidil is the everyday engine. Foam or solution, once or twice daily is tolerated. Expect a small shed bump in the first 2 to 4 weeks as resting hairs release sooner. That's a known effect, not failure. Judge it at 12 weeks, not 12 days. Apply on a dry scalp, let it settle before styling, and give it space from irritation-prone products. Consistency beats perfection. Missing a day isn't the end. Missing weeks is. For men with genetic pattern loss, a DHT-lowering medication like finasteride can protect follicles from miniaturization. A doctor should guide dose and monitor side effects. Some prefer topical versions, some use low-dose oral, some combine with minoxidil. There's also dutasteride in certain cases. Again, that's a medical conversation. For women, the map is different. If androgens play a role, physicians may use spironolactone or specific oral contraceptives. If signs point to PCOS, treating that base condition changes the hair story. Don't borrow plans from someone with a different biology. Build a stack that matches yours. There are supportive tools with growing evidence that stack well with the pillars. Microneedling once a week with a clean device can create microchannels and signal growth. Keep hygiene strict, go gentle, and don't layer harsh actives on the same day. Low-level laser therapy, combs, caps, won't wow you in a week, but used 3 times a week for months, it can be a steady nudge. Platelet-rich plasma injections at a qualified clinic can tip the balance for some, especially when combined with medical therapy. Natural care can live in the routine as comfort and support. Diluted rosemary or peppermint oil in a proper carrier. But it's the assist, not the point guard. Women, check iron and thyroid with real numbers, not guesses. If your ferritin is low, correcting it is sometimes the switch that flips progress on. If tight styles are part of your look, trade them for protective styling that doesn't pull at the root. Watch cycle changes, acne, or unwanted hair growth. Those are signals to talk hormones and rule out PCOS. Men, your classic combo is topical minoxidil plus a DHT strategy under supervision. Take note of any side effects and report them. Your hair shouldn't come at the cost of your health. If your shedding started 2 to 3 months after a big stressor, a fever, surgery, or childbirth, your plan focuses on correction, routine, and patience. Telogen effluvium usually improves once the trigger fades and support is steady. Let's drop habits that quietly steal progress. Stop training your follicles to quit with tight daily pulls, ponytails, braids, hats that bite. Stop chemical whiplash with back-to-back bleaching and relaxing. Stop crash dieting that turns follicles into supply chain victims. Smoking constricts blood flow. Heavy alcohol adds oxidative stress. You don't need to be perfect. You need to stop the obvious self-sabotage. When you shop, cool head, warm heart. Bottles make big promises. Follicles care about environment and consistency. A gentle cleanser you'll actually use. An anti-inflammatory or antifungal shampoo once or twice weekly if flakes or oil are an issue. A leave-in you tolerate with caffeine or peptides if you enjoy it. A delivery system that fits your routine. Be skeptical of overnight miracles or ingredient salads with no mechanism explained. Good routines are boring on purpose. Your timeline matters because motivation expires without proof. Week 0 to 1. Photos under good light. Front, top, both sides, crown. That's your baseline. Start minoxidil once daily for a week if you're sensitive, otherwise follow the label. Fix deficiencies if labs say so. Add the 3-minute daily massage. Swap tight styles for loose. Add protein and greens to each meal, an omega-3 source, a short walk after dinner, and an earlier bedtime by 30 minutes. If you see a small shed bump after starting minoxidil, breathe and continue. It's a known phase. Weeks 4 to 12. Shedding calms, scalp feels healthier. You may feel baby hairs along the line that once looked flat. Month 3 to 6. Texture and density shift. Photos prove what the mirror denies. Month 6 to 12. Compounding happens. If you stop the pillars cold here, you risk sliding back. Maintenance is part of the deal, like brushing your teeth. Budgets change plans, not results. On a tight budget, gentle shampoo, topical minoxidil, correct any deficiency, free massage, and sleep. On a moderate budget, Add a quality derma roller and consider a reputable laser comb or cap if you'll actually use it 3 times a week. Larger budget and a good clinic nearby. Ask about PRP or, in stable advanced pattern loss, a transplant evaluation, understanding that medical maintenance still protects native hair long-term. Let's clean up myths in under a minute. Hats don't cause baldness. Shaving doesn't make hair thicker. The blunt tip just feels different. Biotin is not a miracle unless you're low. Natural oils can be soothing, but they don't replace minoxidil or medical therapy. And the question, when can I stop, has the same answer as, when can I stop brushing my teeth? The day you're okay with losing what you maintained. Here's a 7-day starter you can screenshot and follow. Day 1 tonight. Take clear photos in the same room you'll use every month. Buy a gentle shampoo and your minoxidil. If shedding was sudden or you suspect deficiency, book ferritin, vitamin D, thyroid tests. Day 2. 1 application of minoxidil to a dry scalp. Set a recurring reminder. 3 minutes of massage while your video plays. Eggs and greens at breakfast, legumes or fish at lunch, lean protein at dinner. Day 3. Swap tight styles for loose. Add a 10-minute walk after your biggest meal. Day 4. If your scalp runs oily or flaky, use a zinc or ketoconazole shampoo today, then back to gentle tomorrow. Day 5. Lights out 30 minutes earlier. Day 6. If you're trying microneedling, start tonight. Once a week, clean device, gentle pass, no harsh actives after. Day 7. Check your reminders, put your products within reach, and take a deep breath. That's a living routine. 2 pro tips no one told you. First, compare photos monthly. Same light, same angle, same distance. Memory lies, photos don't. Second, keep your plan visible. Put your minoxidil where your eyes land after brushing your teeth. Consistency is environmental, not heroic. There's a softer layer no product can touch. Hair is identity. Losing it feels like losing a version of yourself. It's okay to be frustrated, to grieve, to wish for a fast-forward button. But you are not powerless, and you are not late. Every stabilized follicle today is one you won't be begging to return in 6 months. Count the small wins, fewer hairs in the drain, a calmer scalp, a tiny shadow of new growth where light used to bounce off skin. Stack wins. That's how thickness returns. Quietly, then suddenly. Stay with me for the last 10 seconds because this is where most people decide, and most people delay. You have a diagnosis plan, a lab checklist, a scalp routine, a nutrition list, a stress protocol, and the 2 pillars with the strongest evidence. You know the week 1 moves, the month 3 expectation, and the month 6 payoff. Now make the smallest promise out loud, right now. 90 days. Not forever. 90 days of simple, repeatable steps. And if you don't see baby hairs catching the light by then, I want you to rewatch your month 0 photos. Because the most surprising part of this journey isn't that hair can come back, it's that you'll wish you had started 90 days earlier.